All right, so hi everybody, welcome back to my channel. Today we're doing another specialty spotlight, this time with Dr. Anjali Malik, who is a radiologist who has specialized in breast imaging and is also on the medical advisory committee for Bright Pink, which is an organization that educates and empowers women about their breast and ovary health. I'm so excited for you to be on my channel today. Thank you so much for joining me.
Thank you for having me. I'm excited to be here.
This is going to be so much fun. So the first thing that I like to ask everyone who is on my channel is, why did you choose radiology? How did you find it?
So mine is kind of a convoluted story. It's definitely not the path that I thought I would be on. I'm happy to be on here now, but I more than once made comments about how silly I thought radiology was. The first time was when I wondered why we needed to take college physics, and someone mentioned if I was ever a radiologist, I would use physics, and I was like, yeah, but I'm never going to be one, so that doesn't matter. The second time was when we were learning about how the different body elements show up on x-rays, and I was like, okay, I guess that's kind of cool, but I also don't care. And the third is during an anatomy physical for one of our blocks. I think it was just like the general body or the abdomen block. They actually had us go through a dark room that had images up on a light box as part of the practical. So it had like the axial slices from the CT or whatever. And it was this dim, dark, tiny, cramped room, just a nightmare. I mean, no one would like that at any point. No radiologist would like that either. And anyway, I was like, oh, this is terrible. I would never want to do this. So, of course, you fast forward to internal medicine block. At that point, I thought I wanted to be an internal medicine subspecialize in GI or maybe a hospitalist. I hadn't quite decided. Turns out I don't like the beeping tube. So hospital is never going to work out. But anyway, so on that block, I wanted to do two things to be a good internist. Master EKGs, which I am sad to say I never did. I read Dubin's cover to cover multiple times, and me and the EKG are just not friends. But also I read Felson's chest primer. Mm-hmm. And I loved it. I thought it was so interesting. I thought he just did such an amazing job describing everything and just like really helped radiology come to life. And of course, being on the medicine rotation, you start seeing those chest x-rays, you start seeing all those shadows and how they come into play and the right upper lobe pneumonia and things like that. So that was really interesting. And what actually not just pushed me into radiology, but actually into breast imaging from the get-go was my next month was general surgery. And my general surgeon was someone who pre-Katrina had been out in the private practice world and had carved sort of a breast niche for himself. Mm-hmm. And post-Katrina, I was at Tulane in New Orleans. And so post-Katrina, he had come back to Tulane and was trying to bulk up his breast practice, in addition to doing, of course, regular general surgery stuff. Mm-hmm. So totally out of the blue on a general surgery rotation, in addition to lap appies and lap choles and, abscess drainages, I was getting to see breast surgery patients. And he was one of those old school breast surgeons who actually did ultrasound core biopsies in the office. He did stereotactic biopsies using the same radiology equipment. It was just, whoever had the table time would take it. And so I was doing stereotactic biopsies as a third-year med student.
Wow, that's
on
amazing.
My general surgery rotation. Yeah. And it wasn't like, an elective. It was just totally my general surgery. And so that was really amazing. And, it introduced the world of radiology to me. I enjoyed the patient population. I enjoyed the pathology, which sounds crazy, but is important. You have to like what you're working with on a day-to-day. And then also, I came to realize some things about me. I'm goal oriented. I like policy. I like working with patients, but also I like that kind of compact, tie it in a bow relationship. And then with someone who has a background in public health, seeing these women who in post-Katrina New Orleans had not had access to, forget mammography, they hadn't had access to anything.
Nothing.
And so I was seeing women who were very advanced in breast cancer at very young ages, who I knew that I could help through early detection. So I wanted to be a breast imaging radiologist from my third year of med school, which was so not the path that, I had entered med school in, which just goes to show you have to keep an open mind. Snarky comments aside, I mean, you can make all the snarky comments you want, but you never know where you'll end up.
No, that's absolutely true. I think that's amazing. That's actually how a lot of med students, find radiology through like other specialties. Although I can't say that many med students have done stereotactic biopsies, But,
yeah, no, it was a very unique situation that I'm obviously thankful for, but yeah.
Did you know like about women's imaging through that general surgeon, or did you just think that the surgeons normally do that?
So that was the thing, is that he wanted me to be a breast surgeon. And I said, look, that sounds nice. Even as a med student, he let me do fibroadenoma excisions, and I had gotten to do some small procedures with him, and I got to see, my surprising skills with my hands and procedures. I did not think that I would ever be good at procedures. I was so terrified of the concept. But I didn't want to do 5 years of general surgery, to be honest with you. I said, look, I like this now, but this is like a 3-4 week intro. What if I go on to hate general surgery and anyway, or just don't even like breast surgery once I get there? So he was the one that actually said, why don't you work with the women's imager? And I did that. And yeah, I mean, obviously I loved it. That's what I do today, but he was a really good mentor, very fortuitous that he came along at the right time in my career and was able to sort of steer me in the right direction.
That's really nice. I think mentors are so important. I had a surgeon. He was actually a vascular surgeon, but his wife was a breast surgeon. And so I mentioned that I was interested in radiology. And so he actually took me to her like breast surgery center, and they had like mammo up there. And so I got to like spend a day there, which was really nice. He's like, I was my surgery sub-I, but he let me do that. So I think it's really nice when the mentors actually take an interest in what you are interested in and actually like go out of their way to do that.
I agree. I mean, I think that, we all know we can make all sorts of generalizations about surgeons or attendings or whatever, but I think we definitely have to remember when we're seeing pre-meds, med students, residents, is that they have a future career ahead of them. And our job is to foster, that career, nurture it. And so, yeah, I mean, I could have done lap appies all day with him. Thankfully, that's not what he did. And, if he had needed me to do that, obviously I could have done that. There's only so much I was going to get out of that, though.
Right.
I mean, he would have gotten the person to retract and maybe close and maybe whatever. But I think that attendings do need to see beyond just that day-to-day case and grind, and think about how med students and residents are trying to make decisions that will impact them for the rest of their lives. So.
Yeah, I completely agree. I think that that's so important. We have a med student with us right now who's interested in oncology, and I'm like, okay, there's so much I can show you that's like relevant to you in radiology. But anyways, speaking of procedures, since you mentioned that you are good with your hands, a lot of people are surprised when we say radiology, we do procedures, especially as breast imagers. Like, have you ever encountered, that type of situation? And did you know that? I guess you knew because you found out as a med student, but like otherwise, I feel like most people believe radiologists don't do procedures, and yet here we are doing tons. So tell me a little bit about like the types of things that you do on a daily basis.
Yeah, so I 100% agree. I think not enough people realize that that's what we do, that we do procedures, that we see patients, that we, really manage our own patients to some level. And it was certainly something that I was surprised about. Again, I thought that radiologists sat in that dark little room that I had to go to for my anatomy practical. And so I do, a lot of biopsies. I'm the biopsy doctor tomorrow morning. I'll be, I have a biopsy of the thyroid that I'll be doing, because I also do thyroid FNA, because I do general ultrasound with my practice, but also because if I can do an FNA of a breast nodule or lymph node, I can do it for the thyroid, as long as I'm able to do that rad path correlation, which I do. So I'm doing a thyroid biopsy, I'm doing an axillary core biopsy, I'm doing a breast biopsy under ultrasound, I'm doing an MRI biopsy, I'm doing a stereotactic biopsy using mammograms. So we, can do biopsies with every modality that we do at my facility. We don't offer CESM or any of the molecular imaging, but we do mammogram, ultrasound, and MRI guided biopsies. And so, yeah, I do a lot of those every single day. So, and that's just me as a breast imager. Obviously, we can do biopsies, drainages. I recently had to aspirate, a potential infected hematoma for a patient. So I was able to send that for culture and sensitivity. So a lot of really amazing things that we do as radiologists, and specifically breast imaging radiologists.
Yeah, I think that's one of my favorite parts of breast imaging is being able to have hands-on and feel like I'm actually doing something for the patient. What would you say is your favorite part of being a breast imager? What's the most rewarding?
Definitely knowing that I am offering early detection and saving lives. I have that background in public health. I was a public health major at Johns Hopkins, and did a lot of my training at Bloomberg. And so, epi was front and center of my college career, statistics, just population-based health. And so being able to have that global impact while also taking care of patients on that individual level is something that I love about breast imaging. I do love doing procedures. It is a satisfying, like weirdly gratifying, just doing a quick ultrasound core biopsy. It's not something I ever would have, expected to like doing, but I do. Yeah, the term biopsy queen has been thrown around because
awesome.
I'm doing them, and I'm, I do a lot of them. So yeah.
Biopsy queen, I love it. Now, you're very active on social media, especially about breast health and, ovarian health, as you mentioned. What got you into social media, and why, how did you find this passion?
So I had always been big on community outreach from my, medical school days, college days when I was working in public health and doing a lot of community outreach and canvassing, and had always, kept up with that through various student organizations or national organizations like medical organizations. And, breast imaging lends itself to that in terms of that outreach and messaging. And so when I started at my first private practice, I knew that I wanted to, try to make an impact. And I was able to do that on a community level, but I wanted to see where I could take it from there. And a friend told me to join Twitter, which I did. And I very quickly connected with a lot of my, Society of Breast Imaging colleagues, a lot of my American College of Radiology colleagues. And that was really cool to be able to do that so quickly, at the click of a button. And I'm connected to all of them, and we're exchanging ideas. And so I think Twitter is good for that. To me, Twitter is good for connecting to other people, but it wasn't quite what I wanted from a messaging standpoint. I know we still do use it a lot. We do the Twitter chats and we do, the campaigns and stuff, but it was when someone told me that Instagram could be used for, of course it could be used, but that people were starting to use it for more sort of professional messages. I thought, oh, of course, you get more text, you get pictures and images or infographics or whatever it is that you want to do. And of course, now we have videos and reels and things like that. And so ever changing and trying to keep up with the algorithms and whatnot is of course a pain. But
that's impossible.
Yeah, because for those of us that have actual day jobs, it's just not realistic. But still knowing that you have a platform and you can reach a bigger audience, I think is really meaningful. So, not everyone's going to have the biggest stage. Only so many doctors are going to get on whatever, be true medical media specialists, right? Whether it's the Sanjay Guptas or the people on TV. And I'm not necessarily looking for that, but I did feel like I wanted to take my messaging beyond just the community talks or just the one-on-one that I do with patients. And so that's how I started on social media, and it sort of went from there.
That's awesome. Yeah, I also love social media. Obviously, here I am on YouTube making videos, but I think it is really fun, and you connect with so many more people than you would just normally. So I really love it. I think it's where I go for information when I need something. So I can understand why other people, do the same. So I'm really happy we have awesome people like you representing our field, especially as women. I think it's really important. So thank you for all of your advocacy for us. I really love that.
No, thank you. I agree. I think one of the really cool things has been connecting with so many powerful women in medicine, women in radiology. And then also the other cool thing about social media, again, Twitter is a really good place to connect with other colleagues. Instagram and TikTok and things like that. I'm new to TikTok. I am not.
TikTok is awesome.
I'm not full on TikTok. I mean, I enjoy watching other people's TikToks and I make my own, knowing that they're not going to go very far for now. But you do connect with patients or the public. And I get questions asked, and I'm very clear. I don't offer medical advice, but for example, a patient, was frankly freaking out to me in my DMs about radiation from a chest CT. And while my, party line was, you should look at the American College of Radiology website, and I can refer you to it, and here's the link, and whatever, I could also be like, this is not something to be worried about. And I talked about background radiation, and so, you can still connect with people. I've been able to be the impetus, and I mean, it sounds a little narcissistic, but I know I was, because people told me I'm the reason that they did their risk assessment, or that they got their genetic testing, and they set up their screening protocol, and such and such cancer was found, and things. I mean, I don't love to hear that I'm the reason their cancer was found, but
no, I understand what you're saying. Like, you made an impact in their life, and I think that's really important.
Yeah, and so I think it can be gratifying in this, because sitting at my office reading screening mammograms, yes, I'm offering patients early detection. I'm offering them state of the art technology, but I'm not reaching them before they came to me. I'm seeing them afterwards, and I'm happy to do so. But the fact that I'm getting someone in the door somewhere, not even in my door, like, I don't stand to benefit. I don't know, it's really gratifying. So
yeah, no, I completely understand that feeling. Like, obviously I'm not a breast imager, and I don't have, but I do have still, as a resident, I do have people coming into, like, I had someone similarly ask me about the chest x-rays they got for COVID. And they were like, is that a lot of radiation? And they asked me these questions, and at least I can give them a very educated answer on that. And yeah, I think even being able to do decrease anxiety for some people, or get them in the door, as you said, I think it's so important and really unique that we get to do that. So I think I love social media, but I will stop talking about social media. Oh yeah, go ahead.
I think another thing too, and I think a topic that's really important is that obviously a lot of physicians are experiencing burnout. And so a lot of people are looking for outlets, creative outlets, or some sort of something that can sort of bring back the joy of medicine. And social media, it can go either way. Of course, it's everyone's highlight reel, and it's kind of a lot of work. And then the whole algorithm is such a pain in the, it's a pain. And so you can let it get you down, but again, you can also, take pride in those exact interactions that I was talking about, where you are making a difference, or that you're connecting with people around the world, and you're able to learn so much. I've, maybe not about breast health, but I've learned so much about, a lot of OB/GYN issues. I've learned so much about, I learned about intermittent fasting. I really went deeper into my plant-based living and my sustainability and things like that. So I think that there are a lot of opportunities. I've connected with other advocates. I've, set up campaigns based on things. I think there's just a world of opportunity online. So.
Yeah, and I think what you're saying about a creative outlet, I for sure feel that, like, being able to, I don't know, create a stupid little Canva graphic design. It's fun. Like, it just is relaxing. You're not thinking about work for 20, 30 minutes. It's nice. I completely agree with that it is a nice creative outlet. And yeah, you can't get too caught up in the numbers. Otherwise it'll just drive you crazy. But
right. Yeah.
In terms of just to conclude, because I don't want to take too much of your time, general advice that you have for med students or residents med students thinking about radiology, or anyone thinking about breast imaging, what would you tell them?
So, I mean, I guess that was a couple different questions packed into one. So if you're thinking about radiology, I mean, obviously you do want to take that med student rotation with a grain of salt. Watching someone look at something is boring. Right? It's like if we all stood and watched the pot boil or the kettle boil, I mean, that's the classic example for what is boring and what takes long. And so sitting behind someone watching them focus on an image is not interesting. So you have to, kind of expose yourself to the other facets of radiology, the procedures, the seeing patients in like a breast or ultrasound clinic or a vascular clinic, or just, sort of try to be looking at the x-ray on your own when you're in that situation, or the CT or whatever, if you're on the rotation, because otherwise, yeah, radiology rotations are really boring. As a med student, I mean, I don't think they would inspire anyone to go into radiology, except for the fact that, you see the cool cases. They wow you with the cool cases and with the boards cases that you don't, actually see on a day-to-day basis. But so yeah, and I would say also, if you're even remotely interested in radiology, just like really focus on that on all of your rotations too, and just see what an integral role it plays in all of healthcare. Because again, like I went in thinking I wanted to be internal medicine, and so I wanted to perfect the art of the chest X-ray, but through that was able to appreciate more about radiology, and we really do, play such a vital role in healthcare. One anecdotal story is, in my residency, I was in the categorical program at UT Southwestern. So that program used to be, I don't think it exists anymore, but it used to be, you were a radiology resident or intern or whatever from day one. So from PGY1, day one, you were in radiology. You did 9 months of clinicals your intern year, and then you did 3 months of clinicals later in your residency, I think in your PGY3 year.
Oh, interesting. Okay.
Yeah, and they were all tailored to be radiology specific. So it's 4 months of ER, 1 month of pulmonary, 1 month of ortho, 2 months of urology, because we did a lot of PCNs and a lot of non-contact.
Really cool.
Yeah. So the anecdotal story, though, is that when I was a PGY3, I went back and did 3 months of ER. And at that point, I had been taking radiology call for like a year and a half or something. And I was really, really good at being an ER resident, because I had, for the past year and a half, seen pretty much every single patient in the hospital. And I had read almost every single chart in the hospital, because, the, abdominal pain, period. I was like, let me look, do they have a, fever? Do they have a white count? Like, how do they present? Da, 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 da. Especially if you get a normal scan, right? You're like, okay, wait, back up.
I'm like, is this okay?
This is a normal scan. And if, the patient's afebrile and no white count, like whatever, you're like, okay, this is a normal scan. We're fine. We're done. But I ended up being like a really good ER resident. And I don't know. It's interesting how they all play together.
Yeah.
And so that's for if you're going into radiology. If you're in residency, don't put pressure on yourself to pick a specialty. I mean, I don't know when, I don't even remember now when like boards and when applications for fellowships and stuff happen. And obviously they're all matched now, I think, right? They're all
the SBI. Yeah. Breast is a match.
Breast is a match, I know for sure, but are they all? I think they're all matched now. No,
body is not. Nukes and peds are not right now. Everything else is.
Interesting, because peds is one of the ones that's like regulated for like a CAQ. So I would think that would be ACGME regulated. Anyway, either way, I wouldn't put a lot of pressure on yourself. I would definitely, feel out what interests you, and just remember that, if you end up in a private practice, be prepared to do more than just read chest CTs, or, for example, I don't just read breast. So I do maybe 10-15% of body and vascular ultrasound. Well, not vascular, not arterial, but I do other ultrasounds. That's a big part of my practice. So I do a lot of OB-GYN ultrasound. And so I'm kind of like a women's imager light. I don't do pelvic MR, but that's, something that's a skill set that I built on, and I've read every SRU paper and every ORADS paper and everything. And so So I think all while you're thinking of what specialty you want to go in, know that private practice and the real world are not the academic environment. You're not just going to get to pick that one thing. So learn everything and just make sure that you find a way to find joy in the interpretation of chest CTs, because you one day might find yourself doing it.
Oh man, that's kind of sad, but you're right. No, there is actually joy in all of it, I think, because ultimately every single image is a patient, and so it does feel good at the end of the day. You're like, okay, I found like something, whatever it is,
Right.
helping someone. So that's true.
Yeah, on my ultrasound rotations that I do, it's not my specialty, and um so I could go into it like, oh, this is the worst, I hate it, but I inevitably have really good conversations with women about the endometrial polyp that I just found, and I go over like, oh, you're going to get a salience on a histogram, and this is how we do it, and this is what it is, or I've seen so many crazy things on those rotations, because you're imaging every body part, right? Like I'm imaging upper extremities, lower extremities, the abdomen, the pelvis, the thyroid, the whatever. Mm-hmm. So it is sometimes nice to get out of that breast world, even though that is my comfort zone. That is what I enjoy. That is what I love. It's nice to get, especially like you see an OB-GYN and a healthy baby, and you get to, congratulate mom and dad, and, sort of sharing that joy. But yeah, if someone asked me to read a chest CT, I would be sad. But that's also because I haven't read them in years. But just, I've seen people in residency get so in the zone, like, oh, I'm going to be neuro, and so I'm going to do neuro, and that's it. And I think it's really important to remain well-rounded until you find yourself in that situation.
That's really good advice. No, thank you so much. And thank you again for letting me interview you for, the last half hour. I think that was really awesome. Really great advice. And I loved hearing your stories about med school and all of it. I think that was valuable for med students or even residents watching this video. So yeah, thank you again. I really appreciate it.
Absolutely. Thank you for having me.